Hello everybody, how are you? Uh, right behind me is beautiful Lake Michigan in state of Wisconsin, and I found this place inspiring enough to go ahead and answer some questions you've got for me. I feel like you can help someone with book like me who needed your perspective on how to care for dying parent, sibling, child, how to manage, keep faith, and do the right things to comfort them, and how is about them and not ourselves. People confusing saving life with helping to pass away with dignity. They are unable to see that red line where saving life is not an option anymore, that all the options are exhausted, and time to provide comfort began. That could be very general answer. What you can do? You can hold a hand, you can make a prayer. If the person was believing God, make that prayer. End of the days, if they want that cigarette, give them that cigarette. Even if they shouldn't get that cigarette. If they want that vodka, give them vodka, okay? It's like bring the friends to politely to say goodbye. That's a good idea, because they will be not surprised with, and they will gather and remember a good times, and I think that's a very good way to go. And other things are that don't show any conflict, and do not hold on by all necessary means. When it's no rescue operation, you need to understand that this is new situation, that you need to take care of someone who is about to go, and how you can make this with the compassion, empathy, and yet you don't want to murder anybody. So to speed up something, that could be helpful. So there is a balance. You can provide the medication, refer to the healthcare professionals. They will tell you where the situation stands, especially if they have quite a bit experience. They will know for sure. And don't push that food into the mouth if somebody can't swallow anymore. Maybe it's okay to change the food from solid to something soft, and if they want to eat, then give them. If not, that's okay not. And no enforcement, I would say. The only enforcement is when we are dealing in such a moments with the painkillers. That's very important, to keep that track on painkillers. To give, sometimes you need to increase. So the painkillers are very important there. And patient will stop eating because of it. Then the end is more likely closer than further from it, and there could be no consciousness However, uh, the science says that even unconscious people may hear you, what you say. So words of comfort are important to the end, to ensure that uh, everything is okay, everything is closed, done. There's nothing to worry about. That family will be okay, and it's okay to let go. That is very important. It's okay to let go. If someone struggles to let go, that could be separate psychological issue to deal with. And I would say you need to grow with your love to somebody. And love is not always to keep for yourself someone, this attachment, but also love could be to let somebody go, just to let you go. That's a love. And this is, it's required courage, wisdom, and stuff. Probably the most advanced thing I would consider in sense of emotions. That someone love somebody else deeply to the point that it allows to let go in the greater good, because the end could be very painful, right? Painkillers at some point will not work, and believe me, I saw that over and over again. You may give lots of morphine, you can give fentanyl, and the pain could be such that scale that it may not work. Then there is another issue coming, that you may be tempted to shorten somebody else's life. In act of compassion, and well, there is medication like lorazepam, for example, which is medication prescribed for anxiety, to calm the anxiety, but also in correct doses may help to somebody to die with the dignity. And it's very often prescribed. It may change the names, but the chemical concept behind it is pretty much the same. And it's essentially artificial venom of snake, which not everyone knows. And that's what calming person and let the course of the nature to happen. I would not recommend to extend the life. Don't play the God. Don't put the patient on life support forever just because you need to cope with your own grief. Get your priorities straight. Be real. Okay? If it's end, it's end. And I'm talking this from the really a huge experience, personal and on the job. When it's time to go, there is no rescue operation anymore. It's a teeny line in between when you rescue somebody and when the somebody crosses point of no return. I know that it's very difficult teeny line, but if someone is brain dead and the doctor coming and saying, and I was witness of that, and saying, oh yeah, maybe we should make that surgery on the heart. You know, that's a scam, okay? That's a scam artist. Okay. No, we should call the family together to hold the hand. To hold the hand of the person who is about to pass away. To make that prayer. To provide the medication to ease that process. This is my first take on that, and I hope you can take something out of it. Let's see how that works for you. But I hope you will make the right decisions when the moment comes. So few things you can do. Keep clean. Patient needs to be clean. Prevent the wounds. You can use the wipers to wash the body at some point. Don't force to do the shower if it brings too much risk and pain. Patient or family member, when dying, they may have illusions, delusions. Don't argue with that. Don't argue with any bizarre statements. You can just laugh off that. That's all. When the moment comes, please organize that hospital bed. You will see how helpful it is for the patient to lay down, adjust the head angle, so it's need to be about 30 degrees up. It's easier to take a breath. Also, for the patient, also please make sure you are switching sides in the body of the body, position, repositioning of the body. So no chronic wounds will pop up. That is important. Chronic wounds are painful, and infection is very hard to contain when the lack of nutrition is present. People on the end of their life, they may sleep all the time. Let them sleep. Times when they were active at 7 o'clock morning, they gone. The times like that gone. Don't stress out. I saw people on the end of the life under tremendous stress, then they disappointing family that they cannot wake up at 7 a.m. morning. Can you feel that pain over here? Don't you see how ridiculous it is? And once I almost lost my job over that I was letting sleep somebody who actually got maybe a month of life with the kidney stage 4 or 5 failure. I mean, you know, keep common sense over here, all right? Also, if I may suggest, prepare the bathroom to be used by somebody who needs a handler on the wall to hold something, not to fall. And please provide the care 24/7. Someone who can be there. If you cannot be there for any reason, hire somebody who can make sure that patient is not on the floor calling for help with the fracture or after heart failure, and there's nobody to help to lift up. At some point they will show no interest watching TV or go outside. But it's okay to show the light on the end to a person. So on the wheelchair to get outside and see that sunlight, okay, relax outside. It's okay. It's fun. All right. You may go ahead and provide the oxygen to the nose to easy pain and help to take a breath. That also will prevent the falls in many cases. On the floor, falls, which is very dangerous. That's most of the hip fractures coming from. God bless you, and see you around later. All right.